We continue to cover all things that you need to know, including on the medical front, with our chief medical correspondent, Dr. Jen Ashton, here with us again from the LA Bureau. And Dr. Ashton, let's start with this big number, though, that's catching our attention. 1.1 trillion. That is the dollar amount. The Senate is making some progress on a new possible infrastructure deal to the tune of that, $1.1 trillion. Lawmakers are pointing out there's still some hurdles ahead before the bill becomes law, but agreeing last night's vote was a crucial first step. Again, that bill, that infrastructure deal, is one they think is going to be important for this country, to bring jobs to this country. So two sides get together. That's always good to see that there's some progress being made in D.C., right, Jen? But let's start with us going the wrong direction, it seems, in some ways when it comes to COVID. Cases are going up. Delta variant really has taken hold. But now Pfizer, here we go. We've been talking about it. They're making a case for a third shot, a booster. What do we need to know here?
Right. And right here in Los Angeles County, TJ, yesterday they issued a public health emergency alert because cases are going up, and all eyes again on this question about a booster. Yesterday, Pfizer releasing some new data. They are showing the vaccine is holding up well against severe disease, 97% efficacy, which is great. However, against symptomatic disease, meaning you get infected, you have some mild symptom, doesn't require hospitalization, that antibody level is declining at a rate of about 6% every 2 months. Now, this study, the data they talked about yesterday, was done before the Delta variant took hold here in the U.S., so we have to take that with a grain of salt. And we also have to remember, TJ, antibody protection, antibody levels, that is only one part of our immune protection, especially when we talk about the vaccines and what protection they give us. So important data, but still, there's a lot to keep an eye on here.
Are we on the way to boosters being recommended?
Well, here's what we know about this, because it's still controversial. In terms of the booster, inconclusive data right now. Again, Pfizer releasing some that seems to go in the favor of needing a booster. It is likely at some point that it will be recommended for certain people. So 65 years of age and older, those with a compromised immune system. People asking, well, why not just get one anyway? And we have to remember there are always risks. Cost, access, we still need more vaccines worldwide. And there's the potential for having a very strong immune response if you get that third dose and you don't need it. So we still have to follow this closely.
All right, Dr. Ashton, we know you will. We'll check in with you here shortly.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.